Next discussion, for the next discussion we'll be having, we'll talk about what's the type of care. That's if you are living in a country where abortion is legal. A patient comes to you for abortion. What is the type of care you actually give to the patient before the abortion? So they call that a pre-termination care. Okay, so let's look at this. So pre-termination care is a critical process. It ensures that the patient will be safe, ensures that their well-being is ensured, and of course ensures that the patient is properly informed of what they are about to go in. So first of all, you have to medically assess the patient. So you have to confirm that there's pregnancy, okay, using ultrasound, blood test, or those laboratory tests for beta HCG, progesterone hormone levels, estrogen levels, everything. You have to actually confirm the pregnancy. So medical history, this is when you review the past pregnancies. You want to now look at the previous experiences the person has had related to anything, a medical condition. So physical examination, you do all those pelvic examination and all of that to assess uterine size, rule out ectopic pregnancies and everything. Okay. So laboratory tests, this is where you now do tests for hemoglobin levels. You do all those blood typing, and that's blood grouping and cross matching. You do tests for rhesus factors. You want to ensure that the mother is not rhesus negative and the baby is rhesus positive. Do you understand all those kind of things? They also screen the mother for sexually transmitted infections, because you don't want infections pushed to the baby during abortion, because during abortion blood flows. Do you understand? So you don't want a mixture of blood and all of that. Counseling and informed consent. So you have to, if abortion in that country is legal, you have to actually address the person. You should tell the person they should know about abortion, they should know about what they're actually going to go in, the possible complications that could come up, and they should sign a consent form. If possible, a lawyer should even back that up. So preparation for the procedure is based on the age of the baby, based on medical eligibility, patient preference. Do you understand? So before you start the whole process, you give antibiotics, because you want to prevent any infections that might come up. Legal and ethical consideration. Before you do an abortion, it must be legally approved. Do you understand? So in countries where they say that you should only do abortion only when it threatens the life of a woman, please, you must actually identify the medical condition threatening the life of that woman. If not, don't do it, because things have a way of setting back on you, and you might even lose your medical certificate. Okay. So patient education, you should educate them on bleeding, crampings that might come up. Okay. And educate them that if they have heavy bleeding, heavy fever, severe pain, they should always report back to you. You are always ready for them.